As we continue to talk to administrators as part of our Education Roundtable in the New Us, we are now joined by the Assistant Superintendent of Administrative Services for Okeechobee County, Dylan Tetters. Mr. Tetters, thank you so much for joining us.
Glad to be here.
All right, we are seeing, COVID cases rise across the country and, here in Florida. And some of the experts that we talk to say that it's partly due to pandemic fatigue. People are sick of wearing masks. They're getting tired of socially distancing, and they're not doing it as much anymore. Are you seeing that in your schools?
Well, I mean, we haven't had as much kickback on our masks. Our board did approve to go masks, and they'll reevaluate that at the end of this semester. And like some surrounding communities, we thought that would bring some protests. But I do believe that people understand that it's because of the masks and because our staff and students are following the protocols we put in place with our reopening plan, that our positive cases and our numbers of exclusions have been down, as compared to some of the other areas I've seen. I mean, we've had them, we've had positives on campus, but our exclusion numbers are down just because we know we have masks and we know we're taking those precautions.
That is certainly a good thing. Certainly a big part of keeping COVID out of schools kind of falls on the parents, making sure they don't send their kids sick, or that they let the county know if they do have a positive test in their house. Do you feel like you are getting good communication from parents?
Well, initially, we had some incidents early in the year to where, there were some students that went and got tested and still came to school while they were waiting on results. So we had some issues there, because then we find out they're positive and we have to go back, the amount of time to look and check and make sure we're excluding the right people. But once we got the communication out, we put a couple of videos out on our Facebook page and just kind of explained to people that if you have a concern or you have a reason where you need to go test, we just ask that you stay home, and that's students, staff, anybody. I mean, if you feel like you're showing any of the symptoms, and we know there's a broad range of symptoms, but if you're showing any of those symptoms and you go get tested, we're just asking you to stay home, until you get those results back, so we know that we're not putting others at risk while you're there.
We've been talking a lot on our air about how this pandemic can be so difficult for teachers and parents and students sort of dealing through all this. But what about the nurses, in your schools? How are they handling, the added sort of stress and pressure of handling when there are cases or kids with symptoms in the schools?
Well, we're lucky because we work directly with the Department of Health. So our nurses at our schools are employees of the Department of Health. And then we have nurses assistants that work with all of them. So again, they're busy. I mean, they have, you kind of have a sick clinic and a healthy clinic now the way doctors' offices do. And the initial setup of that was obviously a concern because you had to have another room, and in some schools we didn't have space, so we had to create space. And the Department of Health, through those nurses, they communicate, because there could be a student that somebody in their family tested positive that we don't know about. So we have that communication back and forth to where we know students that are not supposed to be on campus for a certain amount of time. So that communication has actually been good, having those Department of Health nurses on our campuses. And I think that's led to not as many students on campus that are positive, because we only know the ones that we get the information from them. So working with the Department of Health, we also know the people in the community that we need to be concerned for because of potential close contacts that may not have been on a school campus. So again, it was a challenge, and we've just been sticking to the protocols and improvise when we need to. And it's just been day to day, like I'm sure you've heard interviewing everybody else. I mean, there was no manual for this. Everybody's just day to day, situation to situation. And that's just how we're surviving.
Speaking of day to day and sort of not knowing what's coming next, Governor has not made an announcement in January about whether or not students can stay home. Is the school, I know there's only 20% of your kids right now that are learning virtually, but are you preparing now for the possibility that 100% of the kids are going to be asked to come back in January?
Well, we took before our board last month. We wanted to. We have three options. We have the face-to-face option, which we consider option one. Option two is the blended, where those students could be at home but following a schedule, and there's live students actually face-to-face in the class, but they follow a normal bell schedule and just come in via Zoom. And then we have option three, which is Okeechobee Virtual, which is a complete virtual program. So what we took to our board, because we listened to our teachers, we listened to our parents, we're actually going at the semester, and we're only going to have option one, which would be face to face, and option three, which would be Okeechobee Virtual at the semester. And that's gonna ease some of that stress from those teachers that are trying to juggle. You're juggling 15 to 20 kids in class, and then you're juggling 5 to 10 kids online at the same time, and all those issues that come up. So just the stress of that, we knew we needed to make a change. We knew the first 9 weeks was too soon to make that. We wanted to give parents the opportunity to kind of see how we were going in the community, before they make that decision on what they're going to do second semester, whether they're going to come back face to face or whether they're going to go completely virtual. And we're in the registration process now. Our registration process ends, I believe the deadline was Friday. Because we also have to make determinations on allocations to schools. We have teachers that transitioned over to that option three to deliver that virtual instruction full time, that if those numbers go down, we're going to have to bring them back to campuses, because we are expecting, we would expect at the end of the semester to be at about 90%, 90% plus of our students that are back face to face.
So regardless of what the governor decides, that option three will still be on the table for January?
Yeah, and that option three, there's still some funding with that. Because it's our virtual school. We don't get 100% funding, but we still get some funding. Whereas what's up in the air is whether they're going to fund option two, which was kind of that blended model, which that was part of that executive order, which they were going to allow us to do that in the fall, but there was no guarantee that was going to be the case in the spring. So that was one of the determining factors also, was it's not a guarantee. We're not hearing anything, and we needed to make a decision moving forward.
Are you getting any pushback from some of those teachers? Because certainly, it is the teachers that may be older or maybe having some sort of underlying issues that have been able to stay home now. Are you getting any pushback from them, knowing that in January they may have to come back?
Well, hopefully we're going to be able to, the people that, transferred because they have medical concerns or medical conditions, or they're caring for others with medical concerns or conditions. We're hoping the way the numbers work out, we're going to still be able to honor a lot of those requests. There were just some teachers that went over there just based on certification and just comfort. So that may not be an option. They may need to come back, but we're going to try the best we can to honor those medical exemptions and honor that the best we can, and still provide as safe an environment as we can. We know that there are some schools that have been able to distance their classrooms, and when more students come back, that may not be an option. So we're really just going to have to make sure we stay up with the seating charts and who is where, and how long are our students and staff around each other, and all those little factors that go into that equation. But we're going to try to honor that as much as we can. But at the end of the day, if all the students come back, we're going to have to educate them, and we still have to stick to class size and all those Department of Ed requirements. So we're going to have to follow that too.
Do you see down the line that one thing that we take out of this pandemic and what's gone on here during this first semester is that virtual learning is much more of an option that might be appealing to some kids than we would have thought beforehand?
Absolutely. I don't think it's going away. That's why we're going to have to just continue to figure out and enhance, our learning options and what curriculum we're going to offer through our Okeechobee virtual school. Because I do think people are going to be comfortable. They're going to be able to provide that environment. And, even they may not be comfortable second semester with sending a student back. So we're still going to have to provide that option. And, with the explosion of even Florida virtual school, we were losing students to Florida virtual school. So we don't we want the students to stay in our system. So we knew we were going to have to get with the times and provide that opportunity.
And what else is sort of a big takeaway? Is there anything else that you feel like the school district has really learned, whether it is about public health inside the school or is about technology, that you think will improve education in Okeechobee County going forward after this?
Well, I mean, we obviously have to keep updating our technology, and we have to make sure all of those technology sources are funded. As soon as we have to go to this model, that's when we lose some of our state funding. In things like being able to buy the computers and buy the technology and the Chromebooks, because we're a one-to-one district. But just because we're a one-to-one district, I mean, we still have to order 700 to 1,000 computers a year just to keep up with the ones that are damaged or crash or whatever. But a lot of that funding is funding that goes away. So we have to continue to maintain that, and that's a challenge. We have some internet issues, across the county. We have some pockets of our district, some of the far corners, north, south, east, and west, that cell phone reception is bad, so you can't even give those students a hotspot. So that's a problem for those students that would want to explore that option, and they may not be able to. So those are challenges. And outside of technology, I mean, just the biggest challenge we're dealing with is we're starting to see, some of those long-term impacts from the mental health standpoint. So our mental health counselors are in schools every day. I mean, they're talking to students, they're talking to staff. We're talking to administrators. It's just been tough, and we've been doing this every day since March. No break. I mean, we've been planning and just, again, day to day, and with no playbook. So that has been a burden, and that's been a burden on parents. It's been a burden on students. It's been a burden on staff, all the way up through administrators.
Well, thank you for all you do to teach and keep things going as well, and that ship as steady as possible in Okeechobee. Dylan Tetters, thank you so much for your time.
Thank you.